be talking about the muscle and the fascia of the hip, the muscle and the fascia of the thigh, and the femoral triangle and the popliteal fossa. So we have the gluteal fascia, the fascia lata, and the iliotibial tract. The iliotibial tract is a thickening of the fascia lata, which helps stabilize the knee during walking and running. And the muscles of the hip can be broken into two groups, the anterior and the posterior group. The anterior group includes one main major muscle, iliopsoas, which consists of two muscles, psoas major and iliacus. Iliacus originates from the iliac fossa and inserts on the lesser trochanter. The psoas major originates from T12 to L5 and also inserts on the lesser trochanter. You can also find a psoas minor, which is a variant amongst different people, so not everyone has one. Which originates from T12 to L1 and then inserts on the iliopubic ramus. The psoas major is innervated directly from the lumbar plexus, and the iliacus is innervated by the femoral nerve. And these muscles function in maxilla. Then the posterior group of the hip consists of the gluteus maximus, medius minimus, tensor fascia lata, and then you have the piriformis, glomerulus superior, obturator internus, glomerulus inferior, and quadratus femoris. So starting with the tensor fascia lata can be found on the anterior superior iliac spine, and then inserts on the lateral condyle of the tibia via the iliotibial tract, which means that the tensor fascia lata inserts on the iliotibial tract, which is attached to the lateral condyle of the tibia. Then you have your gluteus maximus, which originates from the posterior gluteal line, sacrotuberous ligament, thoracolumbar fascia, and the sacrum, and then inserts on the iliotibial tract and the gluteal tuberosity, which is found on the femur. Then this is your, let's go to it, sorry. This is your gluteus medius, which is between the anterior and posterior gluteal lines, which inserts on your greater trochanter. And then you have gluteus minimus, which is between the anterior and inferior gluteal lines and inserts on the greater trochanter. The gluteus maximus is innervated by the inferior gluteal nerve, and the gluteus minimus and tensor fascia lata are all innervated by the superior gluteal nerve. And all these muscles function in rotating the hip and extension of the hip. Then you have your deeper layer of the hip muscles, the piriformis muscle, which is the one in green, is from the sacrum to the greater trochanter. And then this is your obturator internus, this one here. Let's continue to this. Starts from the medial surface of the obturator membrane to the greater trochanter. Then you have your glomerulus superior, this one in green, to the ischial spine to the greater trochanter. This is your glomerulus inferior. This is ischial tuberosity to the greater trochanter. And then this is quadratus femoris, ischial tuberosity to the intertrochanteric crest. And all these muscles are innervated directly from the sacral plexus, and they function in rotating the hip, so external rotation of the hip. So moving on to muscles of the thigh can be broken down into an anterior middle and posterior group. In the anterior group, we have the quadriceps femoris, your sartorius, and then in the medial group, you have your pectineus, adductor longus, adductor brevis, adductor magnus, gracilis, obturator externus, posterior, and then the posterior group, you have your biceps femoris, semitendinosus, semimembranosus. So starting with the anterior group, we have the quadriceps femoris. Quadriceps femoris implies that it's made up of 4 muscles. So starting with the rectus femoris. The rectus femoris originates from the anterior inferior iliac spine and inserts on the tibial tuberosity. But here you can see that the tendon passes over the patella. So this tendon continues as the patellar ligament, which inserts on the tibial tuberosity. Over here we have the vastus lateralis, which originates from the lateral lip of the linea aspera and inserts also in the tibial tuberosity. The vastus intermedius, which just sits on the anterior surface of the femur, so directly on the shaft, and the vastus medius, on the medial lip of the linea aspera. And all of the muscles of the quadriceps femoris insert on the tibial tuberosity. Then we have the sartorius muscle, which originates from the anterior superior iliac spine and inserts on the medial condyle of the tibia. All the muscles of the anterior group are innervated by the femoral nerve. So moving on to the medial group, starting with the obturator externus. This originates from the lateral surface of the obturator membrane and inserts on the trochanter fossa. And then we have our abductor brevis, which comes to the inferior pubic ramus and inserts on the medial lip of the linea aspera. This is the pectineus, which comes from the pecten pubis and inserts on the pectineal line found on the femur. Next, we have our gracilis muscle, which comes from the body and the inferior pubic ramus, so the body of the pubic, part of the hip bone, and then the pubic ramus, and inserts on the medial condyle of the tibia. This is our adductor magnus. The adductor magnus comes from both the ischial tuberosity, the inferior pubic ramus, and inserts on the medial lip of the linea aspera and the medial epicondyle. And then this one is our adductor longus. Originates between the pubic symphysis and the pubic tubercle and inserts on the medial lip of the linea aspera. Okay, now the muscles of the medial group all have the innervation of the obturator nerve. However, the pectinus, so this muscle and the adductor magnus have dual innervations. So this means that the pectinus is innervated by both the obturator nerve and the femoral nerve, and then the adductor magnus obturator nerve, and the sciatic nerve. All these muscles are involved in adducting the leg, so moving it away from your medial line. And I forgot to mention that the quadriceps femoris and the sartorius muscle are involved in extending the knee, extension of the knee. And then our posterior group, the three muscles, biceps femoris, semitendinosus, and semimembranosus. The biceps femoris has two heads, a long head and a short head. The long head comes from the ischial tuberosity. The short head comes from the lateral lip of the linea aspera, and they both insert on the head of the fibula. Then the semimembranosus comes from the ischial tuberosity and then inserts on the medial condyle of the tibia. And then last but not least, we have the semitendinosus, which comes from the ischial tuberosity and also inserts on the medial condyle of the tibia. All these muscles are innervated by the sciatic nerve. However, the sciatic nerve has two branches, a common fibular branch and a tibial branch. The semimembranosus, semitendinosus, and the long head of the tibia are all a long head of the biceps femoris are all innervated by the tibial nerve, and the short head of the biceps femoris are innervated by the common fibular nerve. All these muscles are involved in flexion of the knee and also extension of the hip. However, the semitendinosus, the gracilis muscle, and the sartorius muscle all join together to form the pes ansernus, which is Latin for goose foot. These form the superficial pes ansernus, and then semimembranosus forms the deep pes ansernus, so pes ansernus profundus, which just implies it looks like they're like webbed feet inserted on the medial condyle of the tibia. Okay, last but not least, we have our femoral triangle, which is just a topographical space where you can see the nerves, the artery, and the vein. So the superior border here is the inguinal ligament. Here you have the sartorius, and this is our abductor longus. The best way to remember the contents of the femoral triangle is navel. So N being femoral nerve, A for femoral artery, V for femoral vein, E for empty space, and then L for lymph nodes. And then we have your popliteal fossa. Very nice and easy, it looks like a diamond. So here we have if you like, this is the back of your knee. So if you like feel behind your knee, that's the back of your knee. So you'll have your femur up here, and then your tibia and fibula down here. So this border here is the semimembranosus. You'll find the semimembranosus, the semitendinosus here, and then the biceps femoris on your medial side. And then here you can find the lateral head of the gastrocnemius, and then the medial head of your gastrocnemius. And then the contents of the popliteal fossa are also vein, artery, and nerve. But best way to remember this is first it hurts, it bleeds, and then it squirts, which implies nerve, vein, artery. So you have your sciatic nerve, your your popliteal vein, and your popliteal artery. But depending on, if you go into dissection, depending on where you're looking, the sciatic nerve will bifurcate early, depend on who it is. So this is your sciatic nerve here, and then it becomes your tibial and then your common fibular nerve. That is it. I hope you've understood. Thank you.